Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about discontinuing our orthodontic patients. Now, a lot of general dentists have a hard time doing this, and they have a hard time understanding this concept because when they see patients in their office, it's normally for a quick procedure. You know, it's like a crown prep, it's done in 2 weeks, right? Um, but as you start to do larger procedures, more long term commitments like orthodontics, which might take 1, 2 years, the patients have an obligation and you have an obligation. And if you're not quite sure how that works, it's something that you'll want to talk to your liability insurance company a little more about what their expectations are. And as well, everyone should read their own dental practice act for their own state or their own country, because every single state is different. They can change frequently, and you need to know what your obligations are and what you need to do to keep yourself out of trouble. So you have your job and the patient has their job. And if you don't clearly illustrate how that works in writing, in either there's informed consent, but then there's also patient contract. And you may have something like this already in your office, but if you don't, I recommend that you get a template from your liability insurance company, especially for ortho. I have a few versions of it, but I don't feel that comfortable giving them out because what I might use is different than what you probably should use. And I don't really want to give legal advice either. So in any case, but I'm going to explain to you in my own words about what I think, how it works and what your obligation is. So first of all, anyone that you glue anything to their teeth, you've done IPR, you're moving teeth, you've done a bonded retainer, you now are married to that patient for life until whatever you started is done and discontinued. Okay, so you're responsible for making sure they come in. If they don't show up, you need to make sure they show up. I'm not saying go to their house and pick them up, but you need to show that you've put out a concerted effort to get them to come in. That doesn't mean just texting them and calling them. So of course, whatever your normal frequency is, you're going to give them a call. Now, with ortho patients, it can get trickier, especially with corona, where you can basically easily lose a patient. Patients can ghost you. I mean, sometimes that means that things aren't going well. Sometimes it means things are going well and they're just busy and they forgot. But regardless, even if they're not showing up, you have to put a concerted effort in to have them show up, right? So whatever your normal sequence of events are, the phone call, the email, documenting all that, for a period of time, maybe, I don't know, 1-2 weeks, trying to get them in. Obviously, you have some type of frequency you're going to do. After that, you got to start doing the written letters. In the state I was working in, we had to do 3 written letters over a span of time. I can't remember if it was 30 or 60 days, and they all had to be certified. So once you got to that point, and it doesn't matter whether the patient pays, the patient doesn't pay, whatever it is. If the patient has things glued on their teeth, or if you're moving teeth, or you've given aligners and they're moving teeth, you've done IPR, you've extracted teeth, you've done a bonded retainer, you are now obligated and responsible to take care of that patient and make sure they come in your door and they get taken care of. So, like I said, if they're not showing up, you're going to have to fire your patient, Now, how do you know if they're not showing up? Well, you can't just go that there are no showing appointments because they may not have an appointment. They may be canceled with somebody, said they're going to call back. So you have to run frequent reports. If you're in open dental, you can run reports on ortho cases that have started, and hopefully you have a code for that. Your D8080, D8090, D8060, D8070, D8050, 40, 30, 10. All your D80s. You can run reports, see who's still in it, who's actively in treatment, as opposed to those that have been debonded. And you want to get your active patient list. I mean, I recommend that you cross-check that report with an active patient list that you really should just have somewhere, in a HIPAA compliant way. You should know exactly how many active patients you have at any given time. It should be an answer that everyone should have, both front and back office. You should know we have 86 patients actively in Invisalign, and 35 patients actively in braces, and 25 patients actively in expanders, or whatever. Everyone should know the answer to that. And you need to cross-check, and anyone that hasn't been coming in, in their period of time, you need to put that effort out to getting them in, or start the process of discontinuing them, in a kind way, because sometimes people just forget and they get busy. But ultimately, you're responsible for this patient, and you're responsible for their teeth, whether you've seen them or not. So if bad things are happening and you didn't try to get them in, you're potentially liable for whatever happened, from perio to cavities or anything that could be under or over or around their teeth. So unlike a regular recall patient in an office that's just, hygiene patient, if they don't show up, they don't show up. Completely different if you started orthodontics on them. You are responsible. You need to manage them. You need to know when they're coming in. You need to know if they're coming in or not, and be going through your sequence of events. And that needs to be somebody's job, but ultimately the doctor needs to know and has to supervise that. So, and it gets a little bit more iffy if they're not paying their bills. That's where you want to talk to your liability insurance company and see how that goes, because it's tricky, especially if it's a minor underage. If you started something, you can't really leave it half done. That's really below standard of care. So sometimes you're still going to need to see them, in the meantime, while you deal with collections, or, sometimes the patients are fine with you debonding, and doing retainers or not doing retainers. But in any case, hopefully this was helpful. I know a lot of doctors really aren't aware of their responsibilities, and I think it's something super important. All right. Thanks so much.